Alberta's Chief Medical Officer of Health says the crunch in Alberta hospitals is starting to improve. She's blaming high ER wait times on an unusually large wave of influenza cases. Doctors insist the problem goes deeper than that and say they're wrongfully being painted as alarmists. CTV's Hogg reports.
Over the course of December, influenza A activity rose steeply and placed significant pressure on emergency departments, congregate care sites, and care providers across the province.
Alberta's top doctor says higher than expected flu cases in the province has put tremendous strain on the healthcare system. But Dr. Vivian Suttorp says the worst of influenza A, or H3N2, is over.
We are now seeing test positivity rates decline, case counts are beginning to fall, and the number of Albertans admitted to hospital with influenza A is starting to drop.
According to the province, there are 187 fewer influenza patients in hospital today than there were on New Year's Eve. Doctors have been putting public pressure on the government for a week, urging it to declare an emergency.
Government response has been crickets. They've been silent. Having a medical, operational, expert team with authority to run the system 24/7 is how you fix this.
ER Dr. Raj Sherman says Edmonton's system has been over capacity since August. Sherman says the problem is a system that can't care for the number of sick people inside of it. And AHS is no longer integrated after being split into 4 divisions. He says doctors are tired of being treated as alarmists.
They're just putting it simply down to the flu. They think it's going to get better in 10 days when the flu goes away. And that's simply wrong.
While the province says influenza A has peaked, Dr. Vivian Suttorp says influenza B usually peaks later in the flu season, and the best way to protect against it is to get a flu shot. Dr. Suttorp did not answer questions about doctors' demands, referring them to Minister of Hospitals Matt Jones and an Acute Care Alberta statement pinning capacity issues on the respiratory virus season.
I'm hoping to hear that the minister acknowledges what's really happening, that the healthcare system is an absolute crisis, that crisis of the whole system surfaces in the ER departments that he is responsible for.
Jones is scheduled to take questions from the media Thursday. Hogg, CTV News, Edmonton.